Welcome to Raaonline. Today we are having a very interesting topic, the REBOA in trauma. This is one of the very advanced topic in trauma. Okay, let's see what is this REBOA in trauma. Understand, hemorrhagic shock due to a non-compressible torso injuries is a leading cause of death in your military personnels, of course in your trauma victims as well, right? So imagine that you see a patient like this, which is given in this picture. This is not easily compressible, right? And the patient will be dying in front of your eyes. So what can you do for this is the question. A variety of damage control surgical techniques was introduced, like abdominal packing, non-essential organ removal. You can remove the spleen, sometimes you can remove the liver if it's torn apart, extraperitoneal packing, resection of involved bowel, external fixation or embolization of particular artery. All these things have been developed. Remember, you can even do a thoracotomy and go in towards the aorta and clamp the aorta in certain cases, if at all you have the facilities, just to maintain proper blood supply to the heart and the brain, right? So all these things were tried to save the patient. And ultimately, we have this kind of advanced technology, which is the resuscitative endovascular balloon occlusion of the aorta. This is REBOA. Whenever you get this question in your exam, if you write this expansion properly itself, you'll get some marks. Resuscitative by endovascular balloon technology, you're going to occlude the aorta. Okay, it's a self-explanatory question. That is, what is REBOA? Resuscitative endovascular balloon occlusion of the aorta. Okay, this is basically a novel technology for handling the non-compressible hemorrhage. Right, the endovascular balloon is placed in the aorta to control the hemorrhage and to augment the afterload in traumatic arrest and hemorrhagic shock status, right? So you have the heart here, right? And the aorta comes like this. In the abdomen, there is a trauma, okay? And it's a non-compressible area. So what will you do? From the femoral area, you're going to put this catheter inside, go till here, inflate the balloon here, basically occluding the aorta. So once you occlude the aorta, the blood pressure rises steadily. Okay, so once it rises steadily, there will be adequate blood supply for the heart and the brain. Okay, so by increasing the afterload, when there is pressure here, the afterload is increased. Okay, so that you can save the brain and the heart of the patient. Of course, this comes with other complications as well, but compared to death, these complications are very minimal. So this tends to cause less physiological disturbances and have higher rates of technical success than aortic cross clamping. Okay, imagine your patient is having a profuse bleed inside the abdomen where you cannot stop them. So what options you have is either open the thorax, go to the aorta and cross clamp it. That is one thing. Or second, how many of you have tried putting a femoral arterial line? It's very simple procedure, right? You would have did somewhere around 500 femoral lines by now, right? So this is as easy as putting a femoral line. Okay, just put a femoral line. Instead of putting that guide wire, put a bigger size guide wire and go with the guide wire, mark it properly, put a catheter and balloon dilatation has to be done. Very simple procedure if at all you practice it accordingly. So you'll be able to save the patient if your patient is coming with a hemorrhagic shock in a non-compressible area. Okay. So REBOA is a technique for temporary cessation, very important. It's not that you do this procedure, you inflate the balloon inside the aorta and leave it like that, right? It's not that way. So REBOA is a technique for temporary cessation of limitation of blood flow through the aorta, which is used as a bridge until a definitive control of bleeding by endovascular procedure, embolization or any surgery is performed.